Hey there! I want to talk about something most doctors won't bring up at your routine checkup. And honestly, it's a little awkward, but it's important. If you've stopped masturbating in your later years, your body might already be quietly breaking down, and you probably don't even realize it. No, this isn't some locker room myth or internet rumor. This is real clinical physiology. Ignoring it can affect your sexual health, your brain, your heart, your sleep, your immune system, even how you feel about yourself. I'm Dr. Mia Carter, a urologist and men's health specialist with helping older adults understand how their bodies change with age. And today, I'm going to walk you through what happens when masturbation disappears from your life. Trust me, this may completely change how you look at your health. Before we dive in, do me a favor. Hit that like button, comment below where you're watching from, and subscribe to True Wellness Network so you never miss science-based tips to stay sharp, independent, and healthy as you age. Now, here's something you might not expect. Masturbation isn't just a leftover impulse from your younger years. It's actually one of the simplest ways your aging body maintains hormone balance, protects your prostate, boosts brain chemistry, and supports emotional well-being. And if you've stopped, or never really kept it up, the cost can be higher than you think. Over the next few minutes, I'll show you what happens inside your body when sexual self-care stops, and what you can safely do about it. In my practice, I see this all the time. Older men come in strong, active, and confident, but quietly, they've abandoned a simple, natural habit. And the consequences are surprisingly serious. Masturbation isn't just about pleasure, it's about function. Function of your prostate, your pelvic muscles, your sleep cycle, your brain chemicals, and your immune system. Think of it as a tiny but powerful daily maintenance tool for your body. Let's go through the 7 major consequences of stopping masturbation in later life. 1. Decreased prostate health and urinary function. One of my patients, early 70s, fit and sharp, kept waking up 4 or 5 times a night to urinate. He never realized that regular ejaculation, even solo, helps keep prostate fluid moving. Without it, fluid stagnates. That leads to inflammation, pressure, and swelling that disrupt urination. You might notice a heavier bladder, a weaker urine stream, discomfort, or pelvic tightness, frequent nighttime trips to the bathroom. Emotionally, it's exhausting. Practically, it can threaten independence and sleep quality. Regular ejaculation helps reduce inflammation and support better prostate function. It's simply the biology of how the gland works. 2. Cognitive fog and reduced mental clarity. Another patient in his late 60s told me, "Doc, I don't feel like myself. I walk into rooms and forget why." Sexual activity releases dopamine, serotonin, and oxytocin, your brain's natural protectors. When months or years go by without sexual release, those healthy surges disappear. Emotionally, you may feel sluggish or less sharp. Practically, it affects conversations, hobbies, and daily focus. One man quit his chess club because he couldn't concentrate anymore. Another retired teacher described waking up feeling blank. 3. Heightened depression and emotional numbness. I once treated a 72-year-old widower who told me, "I don't feel sad or happy, I just feel nothing." Without sexual release, your body loses natural endorphins and oxytocin, the chemicals that reduce stress and support emotional warmth. Emotionally, this can turn into numbness. Practically, you may lose interest in hobbies, socializing, or even eating well. Sometimes, reconnecting with your own body is more powerful than people realize. 4. Poorer sleep quality. Insomnia is extremely common in older adults, but many don't know the reason. Orgasm triggers oxytocin, prolactin, and endorphins, chemicals that shift the body from stress mode to rest mode. Without these, sleep becomes fragmented, shallow, easily disrupted, and poor sleep affects everything: immunity, memory, blood pressure, and motivation. 5. Weakened pelvic floor and circulation. A retired firefighter came to me with urinary leakage and lower back discomfort. His pelvic floor, the group of muscles that support bladder and core stability, had weakened over time. Masturbation activates natural rhythmic contractions that strengthen these muscles. Without them, circulation slows and nerve response weakens. Practically, this leads to urinary dribbling, difficulty holding urine, discomfort when moving, reduced physical confidence. Emotionally, many men feel embarrassed even though it's completely normal and treatable. 6. Lower immune function. Sexual activity boosts IgA, an antibody that protects against illness and reduces inflammation. When months or years pass without sexual release, your immune system loses a natural protective signal. Older adults may notice getting sick more often, slower recovery, flare-ups of inflammation. It's subtle, but it matters. 7. Loss of body ownership and self-worth. This is the one men almost never talk about. A man in his late 70s once told me, "I feel like I'm living inside my body, but not connected to it." When you stop engaging with your body, even gentle self-touch, your nervous system can interpret it as neglect emotionally. This reduces confidence and dignity. Practically, it lowers motivation for exercise, hygiene, and social engagement. Sexual self-care, even in a soft, non-erotic way, reminds your brain, "I matter. My body matters." So, what should you do starting today? Reintroduce self-touch safely, without guilt or shame. Aim for consistency, not frequency. Strengthen your pelvic floor with gentle Kegel exercises. Support your body with sleep, hydration, nutrition, and light exercise. Pay attention to your mood, sleep, and energy. You'll see small improvements quickly. This isn't about trying to feel young again. It's about protecting your mind, your body, and your independence. Aging doesn't mean losing vitality. It means understanding your body in a deeper, smarter way. If you found this helpful, like this video, subscribe to True Wellness Network and share it with someone who may need to hear this. Comment below where you're watching from. Your story can help someone else. Age doesn't define your vitality. Small, consistent actions can restore comfort, confidence, and a stronger connection to your own body. Start today. Your health matters.